Hello, hello. How are you, everybody? Hi, Narella. So I'm waiting here for Dr. Akintade to join us. We are waiting for MoneyFit MD to start our session. Hi, Key to Education. Hello, hello. Okay, let's see. Dr. with Pearls joined us. Latifat, do you have problem with the connection? Yes, so let me see. So it says that you are unable to join. Let me send it again. I send a request.
There we
Okay,
go.
hello.
Hello, how are you?
Good. How are you doing?
I am doing fantastic.
Very good. I'm so thrilled to have you here tonight. We just ended another session. It was an exciting session with Dr. Reel and Dr. Tennyson, and they went through the gastro psychology and they discussed a lot of helpful techniques like diaphragmatic breathing, CBT, gut-directed hypnosis, and we are going to just continue and transition more into the mindset work. Just briefly before I start, I introduce myself and then Dr. Akintade. So I'm Dr. Parasu Janguk. I'm a gastroenterologist and a life coach, and I practice in Austin, Texas. And I'm so thrilled to have my great friend and colleague, Dr. Akintade, here tonight. I go through your bio if that's okay with you,
Sure.
so that we make sure that the audience know you. So Dr. Akindade is a practicing gastroenterologist with a focus on inflammatory bowel disease, IBD. She currently practices at Kaiser Permanente in Sacramento, California, where she is a partner with the group. She's also a certified life coach, and she focuses on helping women physicians create a financial life they love and they're proud of. She believes when physicians are financially independent, they have the freedom to practice medicine on their own terms. She's a mom of three littles and believes that our GI and financial health are all part of our overall wellness. So using her skills as physician and life coach, she has been able to help her patients to continue to strive towards overall wellness and health. Latifat, I'm so excited to have you here. I think we always joke and say that we are twins. It's we are both GI doctor and we are life coach, and your handle is Money Fit MD. I'm Mind Gut Fit MD, so it's sort of like a board game, right?
Yes, it's all about the fit life, right?
I know. So you need to be fit no matter what you do.
Exactly, exactly, exactly.
So, Latifat, I just before we jump into our discussion tonight, I just wanted to ask you a question. Just tell our audience, so as a gastroenterologist, how did you end up just becoming a life coach?
So, hi everybody. I'm Dr. Latifat Akintade. Like you mentioned, I'm a GI doctor. I practice here in California. I'm a board certified physician. So my journey to life coaching was not a very intentional initially journey. I kind of fell into it because I realized that there was something missing in the picture that I had. Okay. The reason why, so I'm a mom, I'm a physician. As some of you may know, there's a lot of burnout in medicine. And about 5 years ago, I realized that my we have a lot of debt in general in medicine because it takes forever to get trained as physicians. So what I found was that I was extremely broke and I had to learn personal finance for myself. That's how I started. And the more of it that I learned, nice mug, by the way.
That's
Yeah. The more of it that I learned, the more I realized that one, it was a part of our education that was missing as physicians, but then also that I realized that it was just one window to our entire life, meaning that it's a reflection of our overall wellness in other parts of our lives. So what I realized is if we are not well, we're always going to look for things to make us well outside of us. And that is one of the most common causes of financial trouble that we get into. So I became a certified life coach to learn how to help us live this life of fullness where life is not all great or all sucky, but we recognize that life is meant to be half and half roughly or whatever. Mm-hmm. And then what I found was that the skill set that I was learning in that was translating into my practice in medicine as a GI doctor. And to be honest, I've always been aware, as we all are, about the impact that our society, our environment, things that are outside of us affects our GI health. But I don't think I completely understood the gravity of it until I got into life coaching. And now I'm like, actually, wait a minute. There are some skill sets that I have learned in this thing that I can now translate into my clinical practice. Mm-hmm. So it's been fantastic because when I get to be a healthier physician, and I get to share those skill sets with my patients as well and teach them how to use it so that they can have a full and healthier GI tract, really.
Amazing, right? Exactly. As you were saying, it's just like, I think the definition of health throughout the years has changed so much that traditionally we believe that health, is defined by lack of physical disease. But then it took us some time to figure out that actually mental health is a very key part of health in general. And you cannot be healthy if you don't have a healthy mental health. And that's, I think, key. And as we are going and moving forward with all these different stresses in our life, just imagine the pandemic and the stress that pandemic brought to our lives. We really cannot ignore the role of mindset work, the role of mental health.
Absolutely. And I think, you and I share a lot in common, as you mentioned, and we've had some of these conversations on and offline. And I think a lot of times when we talk about mental health, people make the mistake of thinking that we're only talking about severe mental illness only. Mm-hmm. And that's not the case. And when we focus on those extremes of you're either completely well or you have a severe mental illness, we actually are missing a huge spectrum where every human being falls into, right? Because this is not just about someone that's on medications or not. We all are human and we all fall under that spectrum of how well our mental health is. And and you and I are both not just talking about depression or anxiety or psychosis or any other mental illnesses here.
Exactly. So I wanted to I see people are joining us. Dr. Harry Thomas, he is my dear colleague here in Austin. I see GastroDoc joining us. Great. So with any further ado, I want to jump in and ask this question, our first question. What's the whole buzz about the brain-gut microbiome interaction and this connection that everybody is talking about these days?
I'm just going to pretend we're all here hanging out, learning and kicking it together. So I'll just be completely down to earth here. Recently, a couple of days ago, I was talking to someone about how I'm not a groupie at all, right? So this is not like this is the in thing. No, this is not about this being the in thing. This is just about education and us getting more and more information, the more time we're spending in medicine, exploring, learning. So the whole brain gut connection, people think like, oh, this is it's not the new buzzword. It's just as present and always been there, the same way my eyes and my nose have always been there. We're just learning more and more about it. But when it comes to brain gut connection, it's this whole idea about the impact of our brain and our gut health. I tell people that our GI tract is our second brain, right? And I'm sure you tell people the same as well. And the fact that there's a reason why we talk about things like I feel sick to my stomach when someone annoys you or when you're irritated is not because there's something in your GI tract specifically, structurally. It's because of that connection that is between here and here. And some of that is nerves, which you could argue is structural, even though we cannot see it unless we look under the microscope. But I mean, we can see our nerves, but in terms of like really looking at the details of it. But there's also the hormones and the microbiome, like you brought about, that we're starting to understand even more and more about. I mean, we're pretty much just like hitting the tips of the iceberg here. We still have a lot more to
Right.
learn,
Yeah.
but we cannot argue, we cannot deny the fact that the longer we go ignoring the impact of our brain, our mindset, our mental health, we're never going to be well as humans until we truly acknowledge the fact that there's a huge connection between this that we're just starting to learn about.
Exactly. I cannot agree more, Latifat. What you said, it's interesting. So, all these sort of like expressions that we use, gut feeling, having butterflies in stomach or in gut. So I was feeling the same before just coming in and talking to Latifat. I said, I've got butterflies in my stomach. That's an evidence that there is that brain-gut connection. And as you said, it's just like the tip of the iceberg, and it's mind blowing, specifically with knowing more and more about our microbiome, that we know how much of an impact it does have in our overall health, including our mental health. Basically, we had an amazing discussion with Dr. B last week about gut microbiome, that these microbes, it's just like now they're going to become an organ. So they're going to be the new organ in our body. It's like our brain. So they have as important of an impact as our brain has in our body, because they're just like basically like there are pilots sitting in the cockpit and just like producing a bunch of these what we call metabolites, substances, hormones, products, chemical metabolites that can affect our heart, can affect our brain, can affect our GI tract, our liver, you name it. And they can affect our metabolism. And it's just like mind blowing. But now bringing the conversation back to the brain-gut axis and this sort of like crosstalk, the strong neurohormonal crosstalk that we know that really exists between our upper brain and our lower brain, or second brain, as you brought up. So can you give our audience an example of what happens so in sort of like, in real life, when we feel an emotion, or if we basically have a feeling, how would that affect our gut?
Absolutely. So you brought up some really great points. You brought up some hormones, right? A lot of us talk about serotonin and some of those ones that we're more familiar with, but there's also the effect of the nerves. So what happens is something is happening. I'll give you an example. I've had patients that are fine during the weekend, and then when it's Monday, it's time to go back to work, they start to have GI symptoms, right? And it's now that question that's puzzling to them, or is there something that I'm being exposed to at work that's causing me to have diarrhea only during the week and not on the weekend? And it goes back to that idea about our thoughts, what we're thinking about, how we feel affects our gut motility, how things are moving. And that is directly, but also indirectly. And there are some people where the way their gut moves, it may cause things to speed up. And in others, it may actually cause them to back up and slow down. And there are some other people that have a combination of both. So when it comes to external things, it's really, really important for us to become more and more aware of our thoughts, about our feelings, and realize that maybe there may be some connection between how we're feeling and what our GI tract is communicating with us, because it's just telling us, it's talking to us. That's all it's doing.
Yeah, exactly. So, recently the Rome Foundation, actually, they changed the name of irritable bowel syndrome or functional GI diseases to diseases of brain-gut interaction. And I think that says it all.
I think that's extremely important, because we need to destigmatize IBS, because a lot of times people think that when they're told that they have irritable bowel syndrome, and I'm using IBS as a short form of that so I don't bite myself, or or even functional dyspepsia or functional GI disorders. A lot of times people make that to mean that they think I'm crazy, or they think that there's nothing going wrong. We understand and we acknowledge, because you and I both have those symptoms, because it's part of our humanness. It's part of being human and feeling those emotions of fear, stress, excitement, depression about whatever it is that's making you feel depressed. So we're not saying that it means you're crazy. So I do love the fact that they've changed the terminology to be more reflective of the neutral term that it is, because it's just part of us being human. In some people, yes, it's more exaggerated, where it impairs or impacts their quality of life, and those are people that we need to find ways of helping. But I was really excited to find out that the name was changed.
Right. So, it's just really mind-blowing, because traditionally, as you said, these patients, the patients with what we know as IBS, they were going from doctor to doctor, from GI, gastroenterologist to gastroenterologist. They were getting procedures, upper endoscopy, colonoscopy, you name it, a lot of different tests. And then they were, in the end of the day, everything comes back as normal. And then they were told, it's in your head, so go home, right? And I think that's actually, it's really devastating for patients, because you say, what is going on? Does that mean that there is something wrong with me? Am I crazy? So how is that I'm feeling the symptoms, but there isn't really anything wrong, organically. And I think that's very important. And the last 5 to 10 years, we actually made a huge progress in the field of GI by just basically working on this connection and building it, and starting this conversation with patients. So when I have patients with IBS, so I think I always talk to them. I just take time and I go through this connection, and I exactly tell them what's the mechanism, what happens, why are you feeling this way, why do you have diarrhea, constipation, and why do you have this exaggerated pain. And just, it's amazing how long this can go. And patients, I can see spark in their eyes when they realize, oh, so there is really this connection. There is an impairment in this connection. We may not find an organic cause. And I think it's very important to diagnose patients, to tell them you have IBS. We shouldn't tell them we don't know what's going on with you. So you have IBS, and IBS is a diagnosis, and it's a disease. And I diagnose you with that.
I agree with you 100% that having that diagnosis can be helpful. What I will say is, in the age of internet and a lot of information out there, part of the challenge as well is when you go online, people say that IBS is what is diagnosed if no one knows what's wrong with you. And that's not the case. IBS by itself is a diagnosis. So there are times when patients will come to clinic with the mindset of, well, if you're saying IBS, that means you don't know what's wrong with me. And I'm always quick to reassure patients and say, I know exactly what's wrong with you. And the most successful patients that I have with IBS are those that accept, recognize that they have IBS, and then it's now a question of, how do we understand this? How do we learn what your normal is? And how do we now figure out how to help you relieve the burden that it may be causing in your day-to-day life?
Exactly. I'm really excited you're here. So we want to, I want to get back to this common topic that we have been talking about. More people are joining us. What is your why is here? Thanks for coming. We both basically are life coaches here. And I think when I was discussing this with my teammate, Dr. Tennyson and Dr. Vani Paleri, that we just started this summit. And I wanted to specifically have this topic. And we were thinking, who can we just bring in? Because this is sort of like, I cannot say a new concept. It's sort of based on cognitive behavioral therapy. applying the life coaching sort of like techniques into sort of like management of patients with functional GI. There are some subtle differences. So I don't, that's why I wanted a separate session, and I didn't want to mix it up. So Dr. Real, just before we get on, so she touched on CBT briefly, but you know, when I started life coaching myself last year, I actually went into life coaching with the whole concept of bringing this concept to treat my patients and treat patients with functional GI. So I have sort of like a just very strong connection and affinity to this sort of like concept. And I started my brand, Mind Gut Fit MD, with just this clear picture that I had to apply life coaching techniques to treating patients and you know, improving gut health overall, not only treating patients but improving their gut health. So and then when we were chatting with Christina and Vanny, I just like you came to my mind. I said I have to get Latifat because she's a life coach and she's GI. And you know, tell the audience about the whole life coaching concept and how do you use that in your practice?
I think there are a couple of ways that I do. And the first one is going completely back to basics, which is recognizing and identifying our humanness, which is that I think a lot of times we have this misconstrued thought that life should be without pain or discomfort. And that anytime there is discomfort, it means that there's something really wrong. Right? And that's why it's really, really important to work well in partnership with your GI doctors and other members of the healthcare team, because what we do is we help you make sure there's nothing dangerously wrong. And then we not come back to this process of saying, maybe the fact that you have a bowel movement right before a big presentation is normal and that nothing is wrong. Because when we think, right, so the whole premise of the coaching industry or the coaching thought work is that most things in life, a lot of things are neutral. And the whole idea behind that is because we all come from different places in life. We come from different experiences. We come in wearing different glasses. And our glasses is what's really going to determine how we interpret the information in this room. So for example, if the same light bulb, if you put a blue shield over it, it's going to be blue. For someone else, it may be pink. So it's sort of like that perspective of we all come into this with different lens on. And that affects what our thoughts is about this specific thing, right? And then our thoughts really determines how we feel. So if I think that life sucks, I'm going to feel like life sucks. If I think that my inflammatory bowel disease is the worst thing that could have ever happened to me, I'm going to feel a certain type of way, right? And then the way that I feel is going to determine how I show up, right? Whether I'm lying down on my bed all day long or whether I'm getting up or whether whatever it is I'm doing. And all those are going to come together to create this life as we know it. So what we try to teach in coaching is recognizing the power that we have in our thoughts and how we have the power to actually look through different lenses at the same thing. And I always remind people that this concept is really simple, but it's really important because a lot of times we talk about, positive thoughts and negative thoughts. I don't use those words. I think about productive versus not productive, effective versus not effective, right? So if I have ulcerative colitis, that can be a pretty significant illness depending on how well you're doing and how the severity of your symptom is and where you are in the spectrum of we discovering what the best treatment option is for you, right? So that can be a pretty significant illness. But I also try to remind people that our goal as their GI doctors is whatever it is that's going on, our hope is it's part of your story and not all of your story. And the ability for us to do that is dependent on you being able to be open to this idea of maybe there are different ways that I can think about this. And I have some control and some power about which options I choose in terms of how I interpret this, whatever it is that's going on in my world.
I love it. I love the fact that you put it so nicely in this context that you said So, it's very important to make our patients understand that ulcerative colitis is a part of their story. It's not the whole story. And Latifat, I think I cannot agree more about the power of our thoughts. So I think it's very important when you work with the patients. A lot of us, we don't know the simple context, or we don't pay attention on day-to-day basis that we choose our thoughts. So it's not like the thoughts come to us. We actually consciously choose them. So we may not be, aware of this, because we tend, our primitive brain has been used for years and years, has been used to protect us against dangers, because this comes from the evolution of our brain and from the times that we were living in caves. So the brain had to help us, was our best friend, had to tell us all the time that there is danger, you cannot do this, you have to be careful, in order to protect us. But then as we evolved, so obviously we are not exposed to that amount of danger, but we have all these thoughts with us, that always the very first thing that comes to mind is always the limiting thought, the thought that is not empowering us. And very interesting, I think, to help people understand what are the facts versus the fictions. What are the facts? The facts are, for example, it's raining out there. This is the fact that anybody can concur on. But what you make that mean, when that's raining, some person may say, "Oh, I don't like rain," or it's depressing when it rains. So this is not the fact. This is only your thought.
Absolutely. It's our thoughts and how we interpret it. And it's not, it's like riding a bike. If you don't know how to ride a bike, you're like, there's no way I'm going to get on that two-wheeled thing, right?
Right.
Right. But it takes practice. And that's what I tell people. But and that's the power of our role as physicians, as clinicians, and other members of the healthcare team, is to provide a space where there's trust, mutual trust, so that when I tell my patients, okay, we've done this, we've done this, we've done that. So the good news is there's nothing dangerous going on. This is obviously impacting your quality of life. Let's figure out how to fix this together, how to understand this, how to reframe it so that it's not stealing your life away. And that ability to do that is dependent on that relationship you have with your healthcare team. And I cannot emphasize that enough, making sure that that relationship, and it's not about liking what they have to say. In fact, I always tell my patients, you may not like what I have to say, but you can trust that I'm saying it with love and kindness. And that's the bottom line. It's that when someone tells you that you're ulcerative colitis, there's more than one way you could think about it. You're like, you're a jerk. You don't get it, right? But it's a pretty bad illness. However, what is our goal here, right? Especially if it's not well controlled. If it's well controlled, it can be just as simple as any other chronic illness. But we have to ask ourselves, what is our goal? Do I want to have a quality of life, right? And it doesn't mean that your pain will go away, but it's just now the pain is pain. What do I think about this pain? When I think that pain is not something that I should ever have, I'm going to feel differently. But when I tell myself, okay, this severity of pain is not normal and I need to talk to my doctors about it, but it's not, life is not the absence of pain, 100%. It changes how we refrain it, and it's better accepted under the shelter of a good, mutually respected and trusted relationship with your healthcare team.
Exactly. So I really love the fact that you're tapping into just basically the emotions, and just letting the emotion and being inclusive about emotion. So a lot of us, specifically, I feel like it's in Western countries, we are under this impression that life should be always rainbow and daisies, and everything should be perfect. And if something, just a very small thing can basically ruin our whole mood and our whole sort of like prospect. But if we sort of like change our prospect and see that nothing has gone wrong, this is a natural part of human being. This is a natural part of our experience as human beings. We go through this 50-50 that you said. 50% of our emotions are basically happy emotions, 50% are not, because we react depending on the circumstances. And you cannot expect that when something sad is happening. So you don't expect people to just have positive emotions towards that. And I think just accepting that this is a part of life and we need to embrace it. And we should not be always happy. I think that's very important. I know some people may disagree here because they think that the purpose of life is always to just be very happy, push, push, push. But I think this is not realistic.
Yeah, and I like what you just said right now, that the purpose of life is not, and I think that's a miseducation we've gotten, is that the goal is to live a happy life. I mean, I would like that. However, what I think is, if that's the case, anytime something unhappy happens, I'm going to resist it and I'm going to always think there is a problem. Right? But when I understand that, okay, I want to strive to have an effective life, to live a life that's filled in completely with the happy, the sad, and all that together. When those things happen, we're not thinking, this is the worst thing in this world. This is not meant to be. So that resistance is not as present when we accept that life is, it's going to be bitter and sour, right? And what I love is, I love that this has been going on for a week now, and I love that you've had such diversity of speakers, because it's important for us to recognize, and for those that may be watching for the first time, that there is the beauty in what we have to offer as gastroenterologists, is that there is something we can offer to help you, right? And we know that the best case scenario is when we use this multidisciplinary approach to get you doing well. So if you're logging in for the first time and you're like, what's going on here? This is one piece of the puzzle. This is one skill set. And if you are in pain, if life feels like your GI tract is out of whack, if eating well gives you 50% improvement, if medication gives you 20% improvement, if working and understanding your brain-gut connection gives you 20% improvement, guess what? You're 90% better if I did that math right? Which is way better than 100% feeling like crap. So this is one toolbox that we think is underused in general. And our hope is that it can continue to help us towards the skill sets and the tools that we all have in our toolbox to help have a more productive GI health.
Exactly. One other thing, Latifat, I work with my patients on is that it's about the definition of the stress and stressful event. So, going back to brain-gut interaction, when we feel stressed, so we may develop GI symptoms, even under normal circumstances, as we discussed. We may just have an exam, then we feel sort of like, wow, I have to go to the restroom a few times. And that's, a normal part of the brain-gut interaction. But obviously in patients who have functional GI diseases, that's more prominent. And then they really, so that they experience an exaggerated response to stress. I think very important to talk to patients and just have them understand what stress is. So stress by itself is neutral. So it doesn't really exist. A circumstance that could cause a stress in me may not cause a stress in you, right? If I'm sort of like, there's something happening and somebody says something may cause a stress in me, but not in your case. So that's a very neutral circumstance. But basically what causes my GI symptom is how I react to that stressful event, quote unquote. The thought that comes to my mind that immediately I start thinking, oh my God, this is really bad. This is terrible. I cannot do this. This is going to ruin my day right now, right? Something went wrong. So that by itself is going to elicit a whole lot of emotions. And those emotions are actually the response, the nervous system. That emotion is finally what triggers the GI symptom. And just like by knowing this connection, and in response to different triggers around us, different life events, we can try to pick the thoughts that are going to serve us rather than the thoughts that are going to make us feel sick to our stomach, literally.
Yeah, literally, right?
Uh,
I don't think we could have a better experiment than COVID in 2020. And I think every person that works in healthcare and even everybody that works in GI departments would say yes, that we've seen a lot of increase in GI symptoms. And it's not, I mean, COVID by itself can cause GI symptoms for sure, but the extra stress that people are going through, whether that's financial or homeschooling kids or being home all day for the first time since you've been married in 20 years, now you're stuck home working in the same room with your spouse. All those things can definitely cause effects in terms of our thoughts about it, can definitely cause downstream effect on our GI tract based on what we just talked about here. And I think that it's been great to be able to offer this as an extra tool for my patients, and I'm sure for your patients as well, in terms of how do we, it's not about how bad this pandemic is how do we reframe this in a way that doesn't cause us to feel more crappy than we already feel based on COVID.
Exactly, exactly. So I think a tangible experience is actually the pandemic experience we are going in. It's just like some people may think, oh, that's a great opportunity actually for me to work from home, to take care of my kids and be close to my spouse, right? So that's a different way to look at it and a totally different perspective that is going to create a totally different result for you compared to the scenario that you brought up.
Absolutely, absolutely.
Yes, it's just like I think a lot of exciting work here. I'm very excited about the future of gut health and so brain-gut interaction. So it's just not a buzz; it's a real thing, as you brought up. And we are just like it's our knowledge in this field is very immature, and we are just like learning. And I'm very excited. I think we live in an era that we have a lot to offer our patients. And it's going to be getting even better for the next 10 years or so.
I agree with you 100%. I mean, I've seen the impact in my patients, the way that I practice medicine, the way that I help my patients feel better, right?
Mhm.
And it's not because I'm solving all their problems, but it's because I'm helping remind them and just show them that there are other ways of reframing this. And and I bring up inflammatory bowel disease because I see a lot of patients with inflammatory bowel disease, but it doesn't change the fact that you need, Lialda or biologics or surgery or
Mhm.
anything like that. But if I can do something small to help you have a less stressful experience, a more productive experience, and a more full experience so that you can just live a more productive life. Why the heck
Mhm.
not? And so this is something that I hope that more and more people will tap into in combination with the other amazing stuff we have with work with therapists, psychiatrists if needed, medications, and all those other things that we have. This will help significantly, and I hope that we can start to employ it more.
Exactly. So I think the future of medicine is more like becoming a more holistic approach and more integrative approach. As Dr. Tennyson and Dr. Reel were discussing right before we came on, this multidisciplinary approach is actually that's something that we need, I think. It's not only about GI. In a lot of chronic diseases that we deal with in medicine, I think that's becoming more and more prominent, that our physical health is not separate from our mental health. And in our case, about our patients, I would say our physical health and mental health, they are really not separate from our gut health. So our gut health is just like basically totally affected by our mental health.
Absolutely. I had someone earlier today who was seeing me for GI symptoms, and at the end of the day, we got to the bottom of the problem, which is you're not sleeping. You're not sleeping, and that's why you have diarrhea. And I think, why would we as humans think our nerves don't need to sleep?
Right,
And
right.
when our nerves are going out of whack, we're like, what's gone wrong? There's a problem. It needs to sleep. We need to embrace our humanness. And I think the more that we truly do that, the better we're all going to be.
Exactly. And sometimes it takes only just listening to patients, right? So you probably listen to the patient telling you that he's not sleeping enough. So I think the expectation for years, the expectations from physicians have been in a way that we just prescribe pills and procedures for everything. So we just give out pills and procedures. But I think a key part of our practice is listening to people and just trying to piece it together. So different types of sort of like our life, what we eat, how we sleep, how do we respond to stress. So these are all just like, they come into play in our experience as human being and when we go through an illness.
Absolutely. Absolutely.
Okay, very good. So I'm really excited. That was amazing. I want to just like if you can give our audience, a few take-home points, and that would be great.
So, take home point, I will say number one is you are human, and to expect that life is going to be completely happy, we're never going to be pain, is like denying our humanness.
I love
So,
it.
so that's one for sure. And number two is IBS, functional GI. Those are all real. It's a diagnosis. We're not making it up. You're not making it up. There is hope. There's a ton of people out there to help. It's a team-based approach. And we just ask that you be patient and communicate with us as your, GI doctors, clinicians. Communicate with us. We're here to help you. We're all on the same team. We're physicians, not magicians. I'm still working on my wand. But ultimately, we can do a lot to help you feel better and live a productive life. And I wish that on everybody here. So thanks for having me.
Amazing. So just like going through some of these comments, thank you everybody for coming. Dono is saying interesting, who can sleep these days? I would say actually since last week I could sleep very well.
Yeah.
So Kitty Catch is saying I prioritize my sleep and do lots of things to get good sleep. So great. So that's amazing. Sleep, at least we say 8 hours of sleep. So that's key. And right, yes. So Latifa, thank you very much for being here. So just tell our audience where can they find you if they have questions, if they want to see what you're up to.
Yeah, absolutely. Instagram is a good place. As part of my own personal wellness, I do limit my social media time, but Instagram is a good place to reach me. Feel free to send me a message. I'm always willing to share whatever knowledge or information I have. You can also email me at moneyfitmd@gmail.com.
Awesome. That was a great conversation. I'm sure the audience learned a lot from you. Thanks for being here. And yes, I think we come back tomorrow at 7:30 Eastern Standard Time for episode 7 of the Fit Gut series. So stay tuned.
Thanks
Thank
for
you,
having me.
Latifat. Yeah,
Thanks for
take
having
care.
me. Bye,
Sure.
everybody.
Bye-bye.